Hi Matthew, how are you today?
Good, thanks.
That's good. The bacterial tests and the saliva samples that we took have come back.
Any good news at all?
Well, as you know, your salivary glands have been damaged from the radiation. Therefore, it doesn't produce very good quality saliva. Therefore, your mouth is very dry and you are experiencing quite a bit of tooth wear. And the saliva that was tested was very acidic indeed.
So how does that change the bugs that grow in my mouth?
The bugs which survive in acid do very well and they overgrow. And that's what the culture tests show. The two main groups of bacteria that we often test for when assessing for decay risk were quite high, which are mutant streptococci and lactobacilli.
Is there any way you can change that?
Yes, we can most certainly change your home care program to include certain things which will help reduce these decay-associated bacteria from growing and attaching. Well, I've got a printout for you here of a sheet with the options, so we can custom design that to suit you.
What about my chewing function?
Well, the x-rays show that the bone of the lower jaw has filled in where your lower molars were removed. So your teeth are looking fine, so that's positive. We will, however, need to do a special x-ray called a cone beam x-ray, and that's just so that I can assess the quality of the bone and the dimensions of your lower jaw. And I'll need to take some impressions for some study models so I can assess your bite in greater detail and do some planning.
So you think I might be good candidates for implants?
Well, we need to take things slowly with the treatment planning. And yes, if all goes well, I would like you to see an oral surgeon who does a lot of implant cases on patients who have had radiation therapy, just because there will need to be some modifications made to the procedures to take into account the low healing potential of your lower jaw.
Even after 5 years I had the radiation?
Yes, definitely. We need to be very careful.